Imagine your brain is wearing a pair of glasses, but the lenses are warped. These lenses don't make you see something completely fake, but they do filter the way you see the world. They might make problems look bigger than they are, danger feel closer than it is, or guilt feel heavier than it should. This is how OCD tricks your mind, by using cognitive distortions or false ways of thinking that feel very real. Dr. Patrick McGrath, a clinical expert on OCD, explains that cognitive distortions are like mental filters. They don't make you hallucinate, but they do influence what you focus on and what you ignore. And if you're struggling with OCD, these filters are usually aimed right at your fears, doubts, and discomfort. Let's break this down, and don't forget to subscribe. OCD thrives on uncertainty. It starts with an intrusive thought, something unwanted and distressing. Your brain tells you it might mean something terrible. That makes you anxious, so you do something to feel better, like checking the stove or repeating a phrase in your head. That's the compulsion. It works for a moment, but then the doubt creeps back in. This creates a cycle. Now here's the tricky part. OCD uses cognitive distortions to keep this cycle going. It convinces you that your fear makes perfect sense, when really, it's the distortion talking. Let's look at some of the most common ways OCD does this. Intolerance of uncertainty says, you have to know for sure, or else something bad might happen. But life isn't built on 100% certainty. People without OCD can shrug and move on, but OCD won't let you rest until you feel absolutely sure, which you never do. Overestimation of threat makes you hit a pothole, and instead of thinking, that was loud, your brain screams, what if I hit someone? Your mind jumps to worst-case scenarios and convinces you they're likely. Overestimation of responsibility makes you feel like if anything bad happens, anywhere, to anyone, it's somehow your fault. If I don't pray right, my mom might die. It's like being stuck in a superhero movie where you think your thoughts control the universe. Thought-action fusion is when you have a violent thought and suddenly feel like a monster. If I thought about harming someone, it must mean I want to. But that's just not how thoughts work. Thoughts aren't actions, and having a thought doesn't make you a bad person. The need to control thoughts shows up when you try to force bad thoughts away. But the more you fight them, the more they stick. It's like trying not to think of a pink elephant. The harder you try, the more it shows up. The just right error makes you feel like things must be exactly right to be okay. Maybe it's the way you arrange items or the way a word sounds. Anything less than perfect feels unbearable, even if it doesn't make logical sense. Emotional reasoning tells you that if you feel anxious, guilty, or ashamed, it must mean something's wrong. But emotions aren't facts. Just because you feel bad doesn't mean you did something bad. The shoulds are when you feel like everything you do must live up to impossible standards. I should never make mistakes. I should always be happy. I should know what to do. And if you don't live up to these rules, you feel like a failure. Specialness shows up when you believe that the rules of forgiveness or grace apply to everyone else, but not to you. Other people can mess up and move on, but when you make a mistake, it feels unforgivable. All of these distortions create doubt, fear, guilt, and shame, and OCD uses those emotions to keep you stuck. But here's the good news. You don't have to believe every thought you have, and you can learn to recognize these distortions for what they are: mental tricks. Therapists often use a combination of two powerful tools to treat OCD. Cognitive restructuring helps you spot distorted thinking patterns and challenge them. Instead of reacting to a thought automatically, you learn to ask, is this thought realistic? Is there another way to look at this? Exposure and response is the gold standard for OCD treatment. It helps you face the things that scare you without giving in to compulsions. Over time, your brain learns, this discomfort won't last forever. I can handle it. I don't need to do the ritual. For example, say you always check the door lock 5 times to be sure it's secure. With ERP, you practice locking it once and then resisting the urge to go back. You'd sit with the discomfort and let the anxiety pass. Eventually, it gets easier. OCD is sneaky, but it's not unbeatable. If you've been living with these thoughts and didn't realize they were distortions, you're not alone. There's help and there's hope. With the right tools, you can learn to spot OCD's tricks, push back, and get your freedom back, one thought at a time.